Welcome to Health System CIO's Partner Perspective interview series. I'm Anthony Guerra, founder and editor-in-chief. Today we're talking with Ryan Witt, Managing Director of Healthcare for Proofpoint. Ryan, thanks for joining me today.
It's great to be here.
Very good. You want to start by telling me a little bit about your organization and your role there?
Sure. Proofpoint is a company who is wholly focused from a cyber standpoint on protecting people and how they work and how they interact with their people, their staff, their clinicians, their systems. And what I mean by that is the cyber landscape has changed quite dramatically, and people now are the thrust of almost all cyber sort of attacks. And really, the level of social engineering that we're seeing from these bad actors means that they're really focused on how do they communicate with their peers, how do they communicate with maybe in a healthcare context with patients, how do they interact with maybe their third party or business associates. And so that messaging platform is a big thrust of attack, how they interact with the cloud environment, the importance of cloud apps in running their overall systems or their networks or interacting with patient care or patients is becoming a big thrust of attacks. And so Proofpoint is really trying to focus on all those sort of tools and capabilities that safeguard and secure that environment to give the maximum amount of protection, where at least today is we see the real lion's share of all that bad actor or cyber criminal activity.
Right. All
My
right.
role within
Yeah,
Proofpoint, just to emphasize that
sure.
part of it, I have this tunnel vision focus on healthcare. So Proofpoint made a deliberate investment in trying to become more and more relevant to a small number of industry segments. This is about 5 years ago, so this is a long journey for us, an important journey for us. And my role is to be kind of like the internal and the external megaphone. So
Mhm.
understand what the use cases are, understand how we can adapt our solutions and our partnerships and our capability and adjust our roadmap so that we present the most optimal sort of experience for healthcare industry customers.
Yeah, it's interesting. You use the word use cases, and I hear that a lot when I speak to different IT executives. Um, they they like to take, I think they like to take things from an abstract level. Can you do this or can you do that, or what should we be working on, to use cases? And I guess when you do that, you make things very practical, and then you make your objectives more reachable, definable. Is that right?
It is, and there's a little bit of buzzword bingo going on here too. Maybe we should get rid of this sort of, because it is a very popular sort of jargon these days.
Hmm.
But yes, I mean cyber. If you want to look at this one angle or this one sort of perspective, can be at a macro level. You think, how does it apply to my world? Particularly, you think about how do you explain the importance of cyber as a proactive sort of mechanism that our proactive capability. It's not just some sort of like insurance style. In the unlikely event that we ever were to get attacked, this is how you mitigate against it. It's a proactive capability and proactive sort of stance that should be looked at and invested in. So if you talk about that in use cases, like how does somebody who may be in a healthcare context, who is a consultant to the organization, has legitimate reasons to access both corporate tools, corporate messaging platforms, but also third-party tools and messaging platforms. And that sort of quote unquote use case, how do
Hmm.
you safeguard those various sort of instances, engagements, and what are the capabilities you need to think about, and what are some of the risk threat profiles of each one of those sort of interactions. So yeah, I think it takes the abstract into a um, very bite-sizable, sort of understandable sort of way of looking at it.
Right, right. So one of the biggest things that I've come across recently, no surprise, is this risk posed by third-party entities that a health system is leveraging. We had the Kronos outage, which a CIO, a CISO I spoke to said it was like a gut punch, a wake-up call, because of just the effects, the downstream effects. So let's talk a little bit about that. Your impressions first of that event. and its impact on people's thinking and preparedness and the way they're going about their business? Do you think it had a dramatic effect?
Gosh, I want to say yes, but I kind of feel like healthcare in particular has had a lot of wake up calls from a cyber perspective over the last 3, 4, 5 years. I mean, we've had multiple ransomware events that were wake up calls. We have multiple phishing attacks that have been wake up calls. We have multiple, kind of large scale PHI breaches that have been wake up calls. We've had health systems that have gone down for the best part of a month and can't provide patient care in any sort of meaningful way. That was supposed to be a wake up call. So I don't want to appear to be overly cynical, but I think we have to recognize that cyber attacks are ever present in healthcare. And should you learn from this? Should we learn from this? Absolutely, we should learn from this. And I think the exposure of the supply chain or third party risk or your vulnerability of your business associates is I wouldn't say it's a new tactic, but it's certainly been a tactic that has gained a lot of momentum because of these sort of high profile events. But so we should learn from that, and we should be able to capitalize on that from making sure that the institutions and hospital boards, those can affect cyber strategy, are aware of them. But I don't want to. I find it hard to say it's a wake up call because that implies there's going to be some sort of seminal event or change, and I don't necessarily see that happening,
And I've
unfortunately.
and I've heard this from you. We've talked before, and I've heard this kind of sentiment from you that you seem to feel a little bit of frustration that, and we've talked about this before, that there are certain things that you feel need to be in place to be running a responsible organization. And it sounds like occasionally, more often than you'd like, you're seeing those things not being done and embraced in certain health systems. Is that the case?
I think that's the case, and I appreciate how difficult it is for health systems to do their job. Generally, they are the most noble industry, bar none, in my view, in business. And I have actively chosen to work in healthcare, albeit from a vendor standpoint. So I'm really appreciative of the work that they do, and I don't want to come across as overtly critical or cynical. However, we have to also recognize, that there are other capabilities that are commonplace across other industries. Let me give you just a for instance, right? I recently had some sort of a credit card breach. How did I know about that? Because immediately, almost in real time, somebody was trying to use my credit card to make a purchase. How did I know about that? Credit card company contacted me on text, like, did you authorize this purchase? Does this you? Are you making? So they had the level of tools in place. They had the level of analytics in place. They had the level of automation in place that can detect, mitigate, remediate almost in real time. And there's nothing particularly special about that because that capability existed for a long time. And if probably everybody who's listening to this would probably be able to identify to a similar sort of experience.
Hmm.
Healthcare doesn't have those tools yet in place. And so that exact capability may not be what's needed in healthcare, but the attitudes, what I'm really trying to talk about in terms of the willingness and the recognition that we have to make the investment in this sort of resourcing and tools and layers of security to safeguard our environments. I think that's what healthcare I would like to see embraced more and more. And it's one thing when the breach or the cyber event results in brand erosion. I mean, nobody wants that. No one wants financial loss of an industry that's working on such razor thin margins, or no one wants to see the name on the wall of shame or whatever, and the fines that ensue from all that. Those are obviously terrible events that you don't want to be a part of. But when it really gets to the point where you can't provide patient care because there wasn't there wasn't enough cyber defenses in place, and people who are, you know, mid chemo treatment or mid sort of a very important life event for that patient gets denied or has to denied service or has to go other places for their service, and the hardship it puts on them as an individual. I find that I do get a little bit frustrated about that, and I would like to see the industry be more overt and trying to make amends there. And again, I don't want to be overly critical, but I think it's important that, you know, we recognize that kind of where we are, and there's a degree of patient heal thyself, I guess, if I want to use a phraseology.
So if we can use a football term, it's you want to see the basic blocking and tackling being done. Now, you know Eric Decker from Intermountain. I interviewed him
Sure.
recently, and we talked about all the resources. He's involved with creating a lot of these resources. We talked about all the resources that are out there, um, that he's pointing people to and saying, here, it's not a mystery, right? The blocking and tackling is not a mystery. Here it is. It's laid out for you. Here's the stuff. So what you're saying is do the blocking and tackling. I don't want to see the blocking and tackling missing. Then you're seeing it sometimes.
Absolutely. And I think this is one of the things that's really wonderful about healthcare, because that work Eric Decker's doing with Health and Human Services and the 405D
Hmm.
team, and I think the cybersecurity preparedness documentation, which is very comprehensive and really strong. I mean, it is, you could walk into healthcare or walk into cybersecurity not knowing a whole lot about how to build out a framework, security framework, and there's these amazing playbooks there for you. So
Yeah.
like the work has been done to go show you how to block and tackle, if you want to continue that analogy. So yeah, I think, but at some stage we have to start actually executing on the mission. So and I of course there is good execution on the mission, but there are a number of surveys that come out, and I know it's survey data, but who talk about the level of implementation of certain capabilities, or level of like what capabilities have been installed or implemented in healthcare, and it's shocking when you see that, you know, things that are just basic, multi-factor or encryption
Hmm.
or you know, just I don't want to go down the whole list, but like the adoption rate is sometimes in the, you know, sub 50%. And you're just like,
Yeah.
wait a minute.
Sometimes I hear a disconnect between uh w- sometimes you hear in the security community that CISOs have all the money they'd ever need to spend. And you hear them saying it sometimes, occasionally saying it's not a question of money. People, if you say, make our organization 100% secure, take whatever money you need, they say that's still impossible. That's still not a good deal because even spending whatever I can, I want to spend, will not make us 100% invulnerable. But then on the other side, sometimes I hear that they're not getting all the money they need. Do you know what's going on out there in terms of funding security and health systems?
It's anecdotal, but it
Hmm.
feels like to me those institutions who have the richness of budget you're describing have a IT team or a CISO who do a really, really good job of articulating the importance of the cybersecurity mission
Hmm.
as it connects to the overall hospital mission. So they can make a direct connection to, you know, hospital's mission around patient care, patient safety, you know, words like that, that you need to have, you know, one of the pillars to ensure you have, you're delivering against that, you're delivering patient care, patient safety, is you need to have that robust sort of cybersecurity foundation. Because if you don't, you're extremely vulnerable to falling down on that mission. So I think those who make that connection, I think too frequently, however, there's this connection of security around compliancy. I think one of the real adverse byproducts that I think the industry's had a hard time shaking off was the way that meaningful use kind of relegated security into almost like a compliancy angle.
Hmm.
And so all that investment that was made back then was around, checking off the boxes about really making sure that you were compliant with the regulation. But I think we all knew at the time, and we all certainly know now, that compliancy and security are completely different. So yes, you're compliant, but your systems are porous. So I think in some institutions there's been a hangover and a tough time to shake off that sort of notion.
Yeah, I think they forgot interoperability and security
I
during the
think they
meaningfully.
forgot that one too.
Couldn't do it all, I guess, but
Right,
yeah, those were two pretty big holes.
right.
Um, Blocking and tackling is expanding in a sense. This is something I'm very interested in. I've spoken to CISOs about is the extended definition of business continuity planning as it relates to their role. When I try and do a thought experiment, oh, Einstein, but when I try and do a thought experiment of actually transitioning to paper in some sort of ransomware crisis and then transitioning back again, the coordination that I envision that's required between clinical folks, IT security, everybody is phenomenal. And I don't know if people are game planning that out to the degree it needs to be. Because I think we still kind of hang in our silos, and there's probably a not total comfort with some IT folks speaking to clinical leaders and saying, hey, if this, I need to game plan out if some of these systems go down and how we would coordinate. What are your thoughts around that? That seems to me a very important thing. And I think it's starting to happen, but I think it's slow.
I think it is really important. I think there's an argument that says that while that's really important and needs to happen to some degree, and certainly with the clinical teams as best you possibly can, there's this other argument that says in parallel, you can only ask them to do so many things. And so maybe you should be asking them to have a willingness to change some of their workflows so that they can embrace some technology, in the process that will provide just better safeguards. So maybe you never have to get to the point where you roll out the game plan.
Mm,
So
mm.
I think it's one of those trade-offs about where do you put your investment in time, maybe a little bit of money too, but really your investment in time, because I think that seems to be the big challenge with that community is they are obviously very focused on patient care and that tunnel vision focus on the patient. They don't really want to spend too much time on these back office initiatives, and I understand that. But if I don't know, I might would rather spend them a better time if I had that. If I could get X number of hours with them, I would almost rather say, hey, learn how to use the security tool, or learn about the importance how to go to spot a phishing email. Or I just wondered how I would want to spend that time if I had given the choice and a finite amount of time to work with on them.
So there's a couple things there. You mentioned education, which is something we talk about a lot, creating a security culture. You'll never be successful in security if you don't get your users to care
Right.
about security. So you're kind of talking about maybe continuing to educate clinicians about the importance of security, but it sounds like you're also talking about getting them to give a little bit in terms of, is it workflow, or they
So
don't want to take an extra second. Are
sure.
you trying to say, hey guys, maybe you need to take an extra second here because it's going to give us so much upside in security?
Let me give you a real life, for instance. There is a capability called isolation technology.
Hmm.
Isolation technology essentially allows a user to interact with all the tools and messaging platforms and cloud apps that they would want to interact with, but is done so in such a way that you spin up that engagement in a container. So there is a safeguard in place for that clinician, for that any data that clinician is looking at, for the institution, that clinician's working for on that day. So there is no sort of seepage in or out, seepage of data that shouldn't exfiltrate, or seepage of a malware that or other forms of attack that should get in the network. Containerization technology is really popular if you have a lot of third party or consultants in your organization, and really widely used. And it's a really strong safeguard. Now, it takes a little bit of time to get used to how to work in a container, because essentially it provides you, like if you want to spin up your Gmail, just an example, inside the container, it essentially looks like Gmail as you expect it, but there's a little bit of nuanced change here and there around the edges. If I had to go spend an hour with a clinician or a physician about, hey, do we want to game plan like how you let's go back to old school and pretend how you write a prescription on a piece of paper, and we could collate that and filate that and organize that, it makes sense. Or do I want to teach you how to go use isolation technology so we can maybe mitigate against that event? I don't know, I might choose, let's go use isolation technology, because at first glance I might appear you're going to lose a second or two in your workflow, but you actually, when you see the benefit of that, you might think, you know what, it's better than writing out a prescription on paper.
So you're saying you see this being successful in environments where there are a lot of non-employees working in that environment, like consultants and what coming in. Do you see it as for an environment where you have individual employees using it? You see it as a big solution?
Absolutely.
Yeah.
Absolutely. So we see isolation technology being deployed in a couple of areas. One is what we call the happy clickers. So those, for whatever, happy clickers.
Okay. Right. Yeah, I get it.
Those who just have a habit of clicking on things, right? And maybe haven't really embraced the training or absorbed the training in the way they should. So, okay, you can see a trend line there. Let's put them under isolation. To people who just work in a vulnerable way. I mean, just by the nature of their job, they have to download a lot of third-party forms, files, interact with third-party apps. It's just that they're not doing anything wrong, but the nature of their job.
Yeah.
Like, let's say, like if you're in HR and your job is to go on board or recruit new applicants, you've got to take on resumes and applications and all that. So you working in a more vulnerable way. So you might put that person under isolation. You might put somebody under isolation who is not working in a vulnerable way, but has access to a lot of very valuable information. So maybe somebody in your IT team who's, has all the passwords, knows all. So it's like if they compromise his account, that would be really, really damaging. So, but yes, absolutely, isolation would be applicable for an internal, for an employee, and for a consultant or a third-party worker too.
Do you think this is going to happen with clinicians?
We do see it. We absolutely do see a strong, particularly since ransomware, the big ransomware event the last year or so, we have seen a strong uptick in interest in isolation technology.
And to what degree do you think CISOs in health systems are looking at this and considering rolling it out? Is this widespread, or you think this is not quite something they're really engaging with yet? And is it because this is going to be, even if it's a minor, it will be some sort of workflow adjustment for the users, and they're afraid?
I think all those things.
Yeah.
I think back to maybe your observation of a few minutes ago, this is one of those things where I think they see the value in it. I think it has a priority in terms of their investment stack. I don't think there's a money issue on it per se, but it's a prioritization sequence. When do I deploy this tech capability versus other ones that I'm looking at as well? And so I think that's more of the, to the degree we see a little bit of slowness and adoption, it will be more around how do I just get all my resources in place to get all these things rolled out in time. That's all.
But you would encourage them to take a look at this?
I would absolutely encourage them to take a look at this,
All right.
because it's one of those capabilities that I understand why healthcare has a large number of third-party workers for all sorts of understandable reasons. They have a legitimate reason to have access to those tools that are not supplied directly by that health institution that they're working for on that day. So this solves for that problem. That's just like a big use case that I think everyone can identify with. And I think it does solve for, and it's capability that works. This is unlike other industries. They're waiting for like, hey, what's the next feature roadmap, feature function coming on the roadmap?
Mhm.
This has been around for a while now, so you can definitely deploy this with confidence.
Okay. I've got a few more questions here. I'm gonna let you pick because we could spend all day on the call, but I want to see what direction you want to go in. A few things that I was going to talk to you about here were cyber insurance issues around that, the CISO role, and whether or not or how reporting may or may not matter in terms of whether they're reporting to the CIO or to the CEO, that kind of a thing. And then with the workforce shortage and a lot of people dealing with that, staff augmentation and things like that. So tell me, what do you feel like addressing?
Gosh, they're all good areas to talk about. Let's just go from the top of cyber insurance.
Okay.
So one of the, we talk about how do we make Proofpoint as relevant as possible to healthcare. And so um, I established a healthcare customer advisory board at Proofpoint. And I only say that because it's the only industry we have a dedicated advisory board to. We only have two advisory boards on the company.
Hmm.
One goes across industry, one's for healthcare. This has been a very, very large topic in our community, which is mostly CISOs. There's a couple of CIOs on there as well. And so we talked about this at our meetings a lot, and it's very dramatic about how the rapidly changing cyber insurance world is impacting, um, I think, institutions' thought processes around cyber insurance to the point where the number of questions that are being asked, like when you have to go renew your insurance, like explain your environment or the caveats they need to have in place,
Hmm.
have grown exponentially. So
Hmm.
4, 5, 6 times the level of information they want to take on board to look at, to essentially to the degree of what is your pre-existing conditions,
Hmm. Right.
or what sort of capabilities must you first invest in before we believe that's an insurable event. And when it gets around just ransomware, it's even more pronounced. So we have heard several organizations talking very seriously about this whole notion of just becoming self-insurance. I mean, like, we know the importance of insurance, or they talk about the importance of insurance at a some sort of catastrophic event, which is kind of really what insurance is meant to be about anyway. So they can't do away with it totally, but the level of time and resource and investment means that, you know what, maybe we should just think more and more about making that investment capability and resources and people and teams and processes. Um, and so I don't know how many are actually going to walk. That's a big leap, right? So I don't know how many are actually going to do it. But the topic was strong, robust, and pretty consistent in that this is something that we see being talked about a lot. Um, so I think that's interesting. They do all kind of cite one of the real byproducts or silver lining for this cyber insurance change is to those institutions who or those CISOs who are having trouble explaining the challenges around cyber to their board. When you look at what the cyber insurers are requesting, or the caveats they must have in place, it's very useful to be
Hmm.
able to captivate their attention to say, hey, see, this is a third party now, essentially saying what I've been telling you for a long time. So I see a really, really big change here. Cyber insurance as is today just can't. It's this Something's going to have to change in the industry, right?
Right.
Yeah,
I mean, it's basically like anything else you buy. It's, are you getting value for money? And at some point, if the premiums are so high and the conditions they're covering are so narrow that you say, hey, there's all this money. If we put it into security, it's a better place than putting it into this, where, you know, it's just a question of where you're putting your resources.
right,
It's all about, right. It's the chief risk officer. The CISO is the chief risk officer.
right.
You identify the risk, you are describe the risk to the business leaders, and you allow the business leaders to decide if they are willing to accept that level of risk for the dollars you're investing to get it to that point. They may either choose to invest more dollars to reduce the risk or not, right? And then you have within under that, you have if you want to invest dollars to reduce risk, where are you putting them? Are you putting them to cyber insurance, to tools, to training, education, right? So all these things, is this kind of how you see it in terms of how it
I
works?
see it. I mean, this kind of gets us on to one of your other questions. Is the growing importance of the CISO role, right?
Hmm.
So, and I think you hit the nail on the head. I mean, they are becoming the chief risk officer. I don't see that job title yet, but I wouldn't be surprised if we see that job title going forward. And I wouldn't be surprised as a result if you see the CISO at some stage move out of IT to under the CEO or maybe under the CFO or the COO, because being able to go understand, measure the risk associated to a cyber event, articulating that risk back to the health institution, really to those to the highest level, to those decision makers and stakeholders who can then therefore go affect strategy. I think that seems to be a trend line of how the CISO role is adapting and morphing and becoming far more strategic in a way that we just couldn't see a couple of years ago. And I think more and more it is really being equated to a risk conversation. Acknowledgement that we can't solve for all of it, but we can certainly do a lot better to mitigate our risk. And so how do we assess that risk? How do we understand the value is attached to certain percentage changes up or down in risk, and then what's our tolerance level for that, and if we don't have the right tolerance level, how do we put the mechanisms
Right,
or the strategies in place to mitigate it the best we can against that.
right. If the CISO is evaluating 80% of the risk to the organization as a whole, it maybe not a big deal for them to take on the other 20%, move out of IT and become the chief risk officer.
I This does not sound wildly out of step at all. I can see that happening.
And that's sometimes we've seen CIOs become CEOs of health systems. We've seen that on occasion
We have.
because, again, your technology is such a big part of the entity that, okay, let's just take on a little more. And now I've got it all. So,
Yeah, particularly when the CIOs, it's when you have an entity who really embraces technology
mm,
and used it as a competitive edge.
mhm,
um, the importance of that role evolves, and I could see that happening with the CISO as well. Maybe not that they become the CEO, but their elevation within
right.
the hierarchy and the importance they get to the board or the C suite, I think is becoming higher and higher.
Let's before I let you go, let's talk a little bit about the workforce shortage. It's hit everywhere, clinical,
Yeah.
every department of a health system. Um, we have to assume it's hit security as well. So you've got two things going. You've got people need these specific talents in security. They may be hard to find, but you've also got with everybody going remote, you've got a wider geographical area, perhaps the whole country, perhaps excluding a few states that may be difficult with their HR laws.
Yeah.
Um, but essentially, you have those going in opposite directions. One making it more difficult, one making it easier. But what are your thoughts around the workforce shortage as relates to security?
I mean, we do not have a conversation uh, at a customer in healthcare or not a healthcare where it's not a regular ask is, can you go provide me some sort of staff augmentation?
Hmm.
So it's very clear that everybody is suffering from this challenge. And I think this challenge gets resolved in multiple different ways. There are going to be staff augmentation solutions in place, like what Proofpoint's putting in place in terms of that ability to go provide a managed services capability, not only for our capability, not only for our solutions, sorry, but solutions that are beyond Proofpoint. So we're seeing this and we're trying to put that in place. But also, I think that the further trends we'll see a broader, I think, consolidation of technologies and of vendors. So you have fewer things to manage and to make it a little bit easier to manage. I think you'll see a situation where not only do they consolidate, but they will embrace this sort of outsource model and really will try to find solutions to have as much automation in place as possible. So the more you can automate some of this discovery, some of this sort of analysis, we talk about this in some of our previous sort of calls, Anthony, where Proofpoint has this ability to go tell you which job function and what
Hmm.
departments are much more vulnerable because of a whole number of attributes. Well, the more we can try to automate, through machine learning and try to make that as a deliverable to somebody then who can make the assessment. So I think those sort of capabilities, in addition to staff augmentation and in addition to vendor consolidation, I think those are three sort of strategies you're going to see really start to accelerate in terms of how do people, at least in the short term, deal with these sort of staff shortages.
Yeah, and vendor consolidation, it sounds good on paper. Sometimes it works out, sometimes it doesn't. Sometimes when you're working with a vendor and they get acquired or they acquire someone as a user or a customer, sometimes you're like, oh geez, here we go. What's going to happen now?
No, I hear you. I hear you. And there are, there's lots of pros and cons to a mixed vendor strategy, and hopefully you have the mix you have in place is because the people at the time who made that decision believed that that particular vendor was the best of breed for whatever their use case or whatever their solution was. And I understand that, and that should still be a very important sort of decision factor. But if complex becomes the enemy of efficiency, there's some trade-offs here, and so maybe that's something that you have to always kind of look at. So there are pros and cons for sure.
All right. Well, I will give you a chance for a final thought. I mean, to me, one of the biggest takeaways today is, well, one is the containers, the isolation technology. To take a look at that, that's very interesting. And the other one is the blocking and tackling, the documents we talked about, the resources that are out there. Which, by the way, Eric Decker had mentioned, you get relief if you have some sort of incident and you can prove that you've adhered to these established best practices. You will be looked at much more favorably by regulators. So that's another thing. But would that be your final thought? Just get that blocking and tackling done?
I think that would be thematically around the blocking and tackling. I would also just we're about to come into kind of the big sort of season for hymns and
Hmm.
other sort of large events where we talk about all these sort of topics. I would say from a cyber standpoint, stay focused on where the attacks are occurring.
Hmm.
Today, people are being attacked. They're largely being attacked on email, right? That is the path that is still most favored. I mean, obtaining credentials is the nirvana state for a bad actor. As Eric Decker or others might say, I don't want to put their words in their mouth, but if you're tackling a ransomware event, the likelihood is there was a breach into your network a number of weeks previously. They've been using that time to do reconnaissance and trying to figure out what was really going on. And I only say that because, sure, networks can be vulnerable and medical devices can be vulnerable, and we have to think about the totality of the security environment. But the data is very, very clear. Where today's attacks are occurring is what I was talking about around using social engineering to go attack people. That's the most favored tactic. It's not about 0 days. It's not about looking for network patch vulnerability. Those happen, but so focus where you're being attacked, particularly in a situation now where you have to go make these trade-offs. Hey, we could have this conversation 6 months ago and the landscape could have completely changed, and that's fine. Then we pivot our thinking then.
Hmm.
But for a long time now, it's been around credentials being the nirvana state. And so I would, if I had to place all of my resources or the majority of my resources, I would do my best to make sure that I'm ultra secure or secure as possible in that area.
Right. And that has to do with, as you said, knowing who's being attacked, giving them extra protection, providing education so you have a good security culture and the tools needed to weed out and siphon off as much of the bad stuff as you can. So you're using the tools to help them. The rest, we have to rely on education so they know what's up and protect those high risk people. Right.
Right. And then back to like containerizations of that theme. You don't need containerizations across your
Right.
whole workforce. but
Right.
there's probably, I don't know, 10% that need it, whatever,
Right.
making a number up, because of the way they work and because they're more attacked.
All right, Ryan, wonderful stuff. I appreciate your time today, and it's always good to talk to you.
Thanks, Anthony. I really appreciate it. See you soon.